So for the next lesson, you will study topics of vessels,
My side to close the door.
of abdomen and pelvis. Abdomen and pelvis. So we have already said that at the level of the 11th thoracic vertebra, when descending aorta passes through the aortic hiatus of the diaphragm, it continues to the abdominal aorta. And abdominal aorta ends at the level of the 4th lumbar vertebra by the bifurcation into two common iliac arteries, right and left common iliac arteries. So it is located in front of the lumbar part of the vertebral column and slightly to the left, because to the right from the abdominal aorta there will be inferior vena cava, one of two main veins which collect venous blood from lower part of our body. So yes, inferior vena cava will be to the right from the abdominal aorta. Abdominal aorta as well as inferior vena cava will pass retroperitoneally, yes, and we also said that prerenal fascia, yes, covers both of these vessels from anterior side. So abdominal aorta has, just like thoracic aorta, it has parietal and visceral branches. Parietal branches are those which supply walls, yes. Visceral branches are those which supply internal organs. So parietal branches of abdominal aorta, they are inferior phrenic artery, arteria phrenica inferior, and also lumbar arteries. Here they are, arteria lumbalis. And one more, it is median sacral artery, arteria sacralis mediana. Here we cannot see it. It is a very small vessel that it's like a continuation of abdominal aorta that starts at the level of the 4th lumbar vertebra between two common iliac arteries. It goes downward and it supplies the anterior surface of sacrum. Okay, inferior phrenic artery, arteria phrenica inferior. Actually, it's not purely parietal branch, because besides blood supply of inferior surface of the diaphragm, it gives superior suprarenal arteries, arteria suprarenalis superior, which supply adrenal gland. Yes? Okay, lumbar arteries, arteria lumbalis, here we can see them. They are analogues of posterior intercostal arteries, which arise from thoracic aorta. Yes, so they are 4 pairs because they arise from abdominal aorta at the level of intervertebral discs between lumbar vertebrae. So they are paired right and left, so 4 pairs. And they have the same branches, like there is spinal branch, which goes to the spinal cord, muscular branches, which supply deep muscles of the back. And that's it. So these are lumbar arteries. These were parietal branches. Visceral branches are further divided into paired and unpaired branches. So unpaired branches, they are 3. It is celiac trunk, truncus celiacus, then superior mesenteric artery, arteria mesenterica superior, and inferior mesenteric artery, arteria mesenterica inferior. Celiac trunk is the first branch. It arises from the abdominal aorta at the level of the 1st lumbar vertebra. And it is again trunk, yes? It means it is very short and very fast. It is divided into its terminal branches. So look, here it is, like here, celiac trunk. Somewhere here, and it is divided into its 3 terminal branches. This one, it is left gastric artery, arteria gastrica sinistra. After that, common hepatic artery, arteria hepatica communis, and also splenic artery, arteria splenica, or also it is named arteria lienalis. What this one is? Splenic artery, this one. So left gastric artery is just a branch that goes to the lesser curvature of stomach. It goes from cardiac part, it goes downward, and in some way in the middle of the lesser curvature, it forms an anastomosis with right gastric artery. That is a branch of proper hepatic artery. We'll talk about it later. So common hepatic artery, it is also very short, but here it is, common hepatic artery, and it is divided into proper hepatic artery. This one is proper hepatic artery, arteria hepatica propria. When we were talking about hepatoduodenal ligament, yes, we were saying that inside the hepatoduodenal ligament, DVA, common bile duct, portal vein, and this one is proper hepatic artery. And the other branch of common hepatic artery, it is gastroduodenal artery, arteria gastroduodenalis, this one. So proper hepatic artery, first of all, it gives, somewhere it's written that it arises from common hepatic artery, somewhere it's written that right gastric artery arises from proper hepatic artery. So right gastric artery also passes along the lesser curvature of stomach, but it starts from the pyloric part of stomach and it goes upward. And it forms anastomosis with left gastric artery. And from this arteries branches to anterior and posterior surfaces of stomach. They move, yes? Then proper hepatic artery goes upward to the porta hepatis, and it is divided. I think here we cannot see it, but it is divided into right and left hepatic arteries to supply right and left lobes of the liver. And from the right hepatic artery, cystic artery arises to supply gallbladder. We cannot see it here. So cystic artery for blood supply of gallbladder. Gastroduodenal artery goes downward, and it is divided into two parts also. One of them is superior pancreatoduodenal artery, which supplies superior part of the head of the pancreas and superior parts of duodenum. Superior and half of descending part of duodenum. And also it gives right gastroepiploic artery, which we cannot see here, but right gastroepiploic artery goes along the greater curvature of stomach. From the pyloric part of stomach it goes upward, and it forms anastomosis with left gastroepiploic or gastroamental artery that arises from splenic artery. Why is this artery named gastroepiploic or epiploic or omentum? It is the same, yes, or gastroamental, because from the greater curvature of stomach, greater omentum starts, yes, and that's why, because it goes along the greater curvature of stomach, and it supplies not only stomach itself, but also it gives branches to greater omentum. What did you say? Doctor. Good morning. Good morning. Okay. I thought you said goodbye. Okay. Yes, so it forms anastomosis with left gastroepiploic artery that is a branch of splenic artery at the greater curvature of stomach. That was common hepatic. Now splenic artery, it goes along the superior border of pancreas. Here we can see it, yes, it goes, and here it must be spleen, but spleen is not present in this preparation. So finally splenic artery enters hilum of spleen to supply spleen. Yes, it is splenic artery is the only source of blood supply for spleen. That's why when there is bleeding from this artery, usually we have to perform splenectomy, yes, removal of the spleen. But it is very long. It goes along the superior margin of pancreas, and it gives pancreatic branches to the pancreas, and also it gives left gastroepiploic artery that goes along the greater curvature of stomach to supply, and also it gives short gastric branches. Some is maybe this one, short gastric branches, yes, which go to the fundus of stomach to supply fundus of stomach. So stomach, finally, we can say that stomach is supplied from 5 sources. Yes, there is left gastric artery, right gastric artery, left gastroepiploic, right gastroepiploic, and also short gastric branches. And we should consider all of them when we perform any surgeries on the stomach. Okay. That was about celiac trunk. After that, superior mesenteric artery. Superior mesenteric artery, it arises from abdominal aorta right below the celiac trunk. Yes. And why are these two vessels named superior and inferior mesenteric arteries? Because they pass inside the mesentery. What does it mesentery, Akash, please tell us?
Mesentery is a branch. Ma'am, double layer piece peritoneum.
Yes, double layer of peritoneum
that serves the visceral organs.
No, for the intestines mainly, yes. That serves, yes, for the fixation to the posterior abdominal wall.
And there is an artery and vein passes through the mesentery.
Yes. And now we can see about these vessels. Okay, so here we can see just branches between two layers of the mesentery, yes. And if you know digestive tract, we can. And if you know embryogenesis, by the way, of digestive tract, you can easily memorize which branches does superior and inferior mesenteric artery give. Yes, so superior mesenteric artery gives branches to organs of digestive tract which are derived from the midgut. Yes, and inferior mesenteric artery gives branches to hindgut. So superior mesenteric artery, the very first branch that arises from it is inferior pancreatoduodenal artery that supplies inferior part of the head of the pancreas and part of duodenum that is located below the major duodenal papilla, because boundary between foregut and midgut will be located at the level of major duodenal papilla, yes? After that, it gives branches to mesenteric part of small intestine, so jejunal branch, ileal branch to supply jejunum and ileum. Then it gives iliacolic artery to supply distal part of the ileum and proximal part of the colon. And from iliacolic artery, cecal branches arise to supply cecum, and also appendicular artery to supply vermiform appendix. Yes. After that, superior mesenteric artery also gives right colic artery. Something is wrong. Right colic artery that gives branches supplies ascending colon, and middle colic artery that gives branches to transverse colon. So boundary between region of blood supply of superior mesenteric artery and inferior mesenteric artery passes through distal 1/3 of transverse colon. From inferior, the first branch that arises from inferior mesenteric artery is here we can see some branches. See what it is: left colic artery. Left colic artery supplies descending colon, and it gives ascending and descending branches. So ascending branch of the left colic artery and also left branch of middle colic artery, they form anastomosis at the region of left colic flexure. There are two anastomoses. One of them is constant, that goes along the mesocolic tenia. Yes, mesocolic tenia, it is named artery of Drummond. And one anastomosis is inconstant, that is located closer to the root of mesocolon, closer to posterior abdominal wall, and it is named arc of Riolan's arc. Yes, so this anastomosis help in case of mesenteric thrombosis. For example, in case of thrombosis, clot, occlusion in superior or inferior mesenteric arteries, they certainly are not very big, but they can somehow help to provide blood supply of these parts of colon which are supplied by another artery. Yes, where there is a thrombosis. Okay, so again, branches of inferior mesenteric artery, they are left colic artery that supplies descending colon, then sigmoid branches which supply sigmoid colon, and also the last one, it is superior rectal artery that supplies superior part of rectum. These were unpaired visceral branches. Now paired visceral branches of abdominal aorta supplies paired organs of abdominal cavity. The very first is middle suprarenal artery that goes to the middle part of adrenal gland. Here I cannot see it. No, but yes. The second, it is renal artery, arteria renalis, this one, that supplies kidney. And so if we supply, or if we compare length of renal arteries from the right and from the left renal artery will be shorter than the right one, yes, because abdominal aorta is deviated to the left, yes. But if we compare length of right and left renal veins, left one will be longer because inferior vena cava is deviated to the right. And so renal artery gives some additional branches. First of all, it is inferior, what here we can see it, inferior suprarenal artery that goes to inferior part of the adrenal gland. And so we can say that adrenal gland receives blood supply from three sources. Yes, superior suprarenal from inferior phrenic, then middle suprarenal and from abdominal aorta, and then inferior suprarenal from renal artery. And also renal artery gives branch to a superior part of the ureter, a superior ureteric branch. Here we also can see this one, superior part of the ureter. Okay, and the last branch, period visceral branch of abdominal aorta, it is gonadal branch. In males it is testicular artery, in females it is ovarian artery. So in males it passes through inguinal canal. You should revise inguinal canal for the next lesson to supply testes, yes. And in females it passes through suspensory ovarian ligament to supply ovary. So it was abdominal aorta. Now arteries of pelvis. So yes, I told you that at the level of the fourth lumbar vertebra, abdominal aorta is divided into two common iliac arteries, right and left, and then at the level of the promontory, each common iliac artery gets divided into external iliac and internal iliac artery. So first, external iliac artery, it goes on the anterior surface of iliopsoas muscle, and it passes through vascular space. How vascular space is formed, you also have to revise for the next lesson, yes? And it continues in the side as a femoral artery. This is femoral artery. This is external iliac. So it gives several branches. It gives inferior epigastric artery, arteria epigastrica inferior, that forms, it goes upward to the umbilicus, yes. It forms lateral umbilical fold, yes, if you remember, and it supplies muscles of anterolateral abdominal wall, and at the level of the umbilicus, it forms anastomosis with superior epigastric artery. Where does superior epigastric artery?
Cervical trunk.
No.
Oh, internal thoracic artery will be give the superior.
It is one of the terminal branches of internal thoracic artery. So this one is inferior epigastric. Also, there is superficial circumflex iliac artery. This one, deep circumflex iliac artery, arteria circumflexa iliaca profunda. It goes along the iliac crest, and it forms anastomosis with superficial circumflex iliac artery. We'll study it later, that arises from the femoral artery. No, and it supplies also iliopsoas muscle. No, so this internal muscles of pelvis. And also it forms anastomosis with lateral sacral artery, that is a branch of internal iliac artery, and iliolumbar. So it also gives muscular branches to internal muscles of pelvis. We have to know here that sometimes, not always, from the inferior epigastric artery, pubic branch arises, and it forms anastomosis with pubic branch of obturator artery. Obturator artery arises from internal iliac. And this anastomosis is located in the medial circumference, half of the deep femoral ring. And in case of femoral hernia, intestines, they live through this femoral ring, yes. And when we perform herniaplasty, so the surgery to remove hernia, we need to dissect hernial sac. This one by peritoneum. You will also revise femoral canal for the next lesson. So we cannot dissect it from lateral side because laterally there is femoral vein, yes. And we dissect it medially. And if we dissect it medially, in case of presence of this inconstant anastomosis, there is a chance of severe bleeding. And that's why this anastomosis is named corona mortis. Corona mortis means crown of death. Yes, because in the past it caused severe bleeding, which was very difficult to stop, and sometimes even patient died due to it. Okay, that was external iliac artery. Internal iliac artery, it goes backward along the sacrum, and it has parietal and visceral branches. So parietal branches, they are the iliolumbar, that goes laterally to supply this iliopsoas muscle, yes, form anastomosis with deep and superficial circumflex iliac arteries. That's it. There is lateral sacral that supply lateral surface of sacrum, and the rest are superior gluteal artery. This one is arteria gluteal superior, that leaves pelvic cavity through suprapiriform foramen. How suprapiriform foramen is formed, you will also revise. And it leaves pelvic cavity and it supplies musculus gluteus. That's it. Maximus, what this is maximus? Yes, and medius. This is superior gluteal artery. The next is inferior gluteal artery, arteria glutea inferior. It arises through infrapiriform foramen, and it supplies musculus gluteus medius and minimus. That's it. This one. Okay, and then yes, and one more parietal branch is obturator artery, arteria obturatoria. What, it was like that? Yes, they were together. Obturator artery leaves through obturator canal. How obturator canal is formed, you will also revise. And it supplies internal and external obturator muscles. And after that, it goes out from the pelvis and it supplies medial group of the thigh muscles, this obturator artery. Okay, and this we are with, what did I say? Parietal branches, yes? Now visceral branches, they supply organs. Now, there is internal pudendal artery, arteria pudenda interna. It is mixed branch. It supplies both walls and organs. It leaves pelvic cavity through intrapiriform foramen also. And after that, it, I think we cannot see it. Maybe this one, yes. So after that, it crosses ischio. No, not ischio. Sacrospinous. Yes, it crosses sacrospinous ligament and it enters ischiorectal fossa. So how ischiorectal fossa is one you also have to revise. So it gives perineal branches to muscles of perineum. Yes, it gives inferior rectal artery to supply inferior part of the rectum. And its terminal branches are dorsal nerve of penis in males and dorsal nerve of clitoris in females. So it supplies both muscles, yes, and internal organs. So yes. Okay. Then it also gives inferior vesical artery. This one, yes, inferior vesical artery that supplies inferior part of the urinary bladder, and in males it also gives branch to seminal vesicles, to vas deferens, yes, and also it gives inferior ureteric branch to inferior part of ureter, and middle part of ureter, we skipped it, is supplied from branches of ovarian and testicular arteries. There is also middle rectal artery. Here I cannot see it. Okay, middle rectal artery that supplies middle part of the rectum. So superior part of the rectum is supplied by a branch from inferior mesenteric artery, middle part from internal iliac, and inferior part from internal pudendal. Yes. In females, internal iliac artery also gives uterine artery to supply uterus. And this uterine artery comes up to the isthmus of the uterus and gives ascending branch and descending branch. Descending branch goes downward to supply vagina. Ascending branch goes upward to supply body and fundus of uterus. And also it gives branches to ovarian branch to the ovary and branch to the uterine tube. Tubal branch to the uterine tube.
Is it passes through the uterine ligament?
It passes, yes, inside the broad ligament, it passes through the perimetrium. Between two leaves of broad ligament here. Так, what else didn't I say? Yes, one more branch. It is umbilical artery. Here we cannot see it, but it also arises from internal iliac artery. It goes upward and forms medial umbilical fold. Look here, yes, we can see medial umbilical fold. And in fetuses, it performs very important function of gas exchange, yes. But by the moment of birth, most part of this umbilical artery gets yes, into connective tissue, into ligament just. But proximal part still functions because from proximal part of the umbilical artery, superior vesical artery starts originates to supply superior part of the urinary bladder. That's it. Now veins. Veins, as I told you, there are two veins. There are two veins which collect venous blood from pelvic and abdominal cavity. That is portal vein and inferior vena cava. So inferior vena cava inferior, is located, this is inferior vena cava, is located to the right from the abdominal aorta, and it is formed at the level of the fourth lumbar vertebra by the junction of two common iliac veins, right and left common iliac vein. So it collects venous blood from all the lower limbs, all the organs of pelvis, and paired organs of abdominal cavity. So tributaries of the inferior vena cava, they are renal veins, gonadal veins, and middle suprarenal veins. Yes, that's it. And then this inferior vena cava goes upward. It passes through caval opening or caval hiatus in the diaphragm. We cannot see it here, yes. And it lies in the fissure for inferior vena cava on the visceral surface of the liver, yes. And when it passes through this fissure for inferior vena cava, hepatic veins also drain into it, yes. And then it passes through caval hiatus and it drains into the right atrium. Portal vein, vena porta, collects venous blood from all the unpaired organs of abdominal cavity. And it passes, it is short, it passes inside the hepatoduodenal ligament. It has two routes, superior mesenteric vein and splenic vein. Inferior mesenteric vein drains into splenic vein first, and then splenic vein drains into portal vein. So tributaries of each of these veins have the same names, like branches of homonymous arteries. Yes, like superior mesenteric vein has tributaries. Iliac vein, jejunal vein, iliac-colic vein, no, the same, yes? It's okay, it's clear. And that's it. And then portal vein drains into the liver, and we said that portal vein brings 80% of blood into the liver. A proper hepatic artery brings only 20% of blood. And then finally all the blood drains through the hepatic veins into inferior vena cava. What you have to know, not only veins, but you have to know here portocaval and cavo-caval anastomosis. These are anastomosis between tributaries of portal vein and superior and inferior vena cava. They do not work in normal conditions, but in case of, for example, if you talk about portal hypertension, in case of portal hypertension, it is increasing of pressure in the portal venous system, in the portal vein. This anastomosis start working. In which case does portal hypertension develop? If there is any problem with the liver, yes, when parenchyma of the liver is substituted by connective tissue, such a process is named cirrhosis. It may happen if in case of any viral infection like hepatitis, yes, B, C, and it also may happen in case of alcohol consumption. Also, it may happen if to consume alcohol for a very long time. Not only alcohol, also some drugs. Yes, so toxic. Yes.
Datura.
So please think about it, Shauri. Yes.
Arey ma'am, I don't take anything.
What? Okay, and in this case, when parenchyma of the liver is substituted by connective tissue, number of hepatic lobules gets decreased. So it means that number of central veins also gets decreased, yes? And less amount of blood can pass through the liver during the same period of time. And that's why pressure in portal vein gets increased. And venous blood searches for the other ways to outflow. And in this case, this anastomosis starts working. So for portocaval anastomosis, you have to know at least three. There is anastomosis in the anterior abdominal wall. There is superior epigastric vein that arises. Okay, let's be, yes. Superior epigastric vein that arises from the level of the umbilicus, then it goes upward and it drains into brachiocephalic vein, and brachiocephalic vein drains into superior vena cava. And also there are paraumbilical veins which pass through the round ligament of the liver and they drain into the portal vein. It is one portocaval anastomosis. The other one is anastomosis between, four, yes. The other one is between also paraumbilical veins which pass through the round ligament of the liver and inferior epigastric vein. Inferior epigastric vein is a tributary of external iliac vein, then external iliac to common iliac, yes, and then common iliac to inferior vena cava. So in case of portal hypertension, blood outflows here at the region of the umbilicus, and these veins, this anastomosis, they become very thick and they are visible under the skin. They are bluish and they are visible under the skin like very thick and convoluted cords, and such a symptom is named as caput Medusa, head of the Medusa. Who is Medusa? Yes, in Greek mythology it is a woman whose hairs were like snakes. Did you read about it? No? Oh, конечно, зачем? But hairs were like snakes, and when she was looking at the person, he turned into stone.
Yes.
Did you read?
Mythology.
Yes, it is. Yes, it is not.
Such a movie.
You saw it? What? Good.
Yes.
But, and that's why, because this cord looks like snakes also, the symptom is known as caput Medusa. Yes. The other anastomosis is located in the wall of the rectum. We said that rectum receives blood supply from 3 sources, and venous drainage goes also to 3 sources. So superior rectal vein drains to inferior mesenteric, and then inferior mesenteric to splenic, and then to the portal vein, yes. And middle rectal vein drains into internal iliac. Inferior rectal vein drains into internal pudendal and then to internal iliac. Internal iliac, it is external iliac. Internal iliac, I think. Yes, it's not present here. Okay. Internal iliac drains to common iliac, then to inferior vena cava. Yes? So it is another portocaval anastomosis in the wall of the rectum. And in case of portal hypertension, this anastomosis also become swollen, and it such a disease is named hemorrhoids or piles. Have you heard about it also?
Piles only heard.
Piles, yes. And during defecation, such people can feel pain and even bleeding can start, yes, during defecation. Okay. The third is located in the wall of the esophagus between this abdominal part of the esophagus and cardiac part of stomach, because esophageal veins outflow to two places. First, they drain into azygous vein. Azygous, yes, it's also for the next lesson. Azygous vein, that is a tributary of superior vena cava, and the other esophageal vein drain into left gastric vein, and left gastric vein is a tributary of the portal vein. And also in case of portal hypertension, these veins get enlarged, they become varicose, like dilated, yes, and also bleeding from esophageal veins can start. And it is a very common reason of the death of these people with liver cirrhosis, like bleeding from the esophageal veins. Okay. Cava-caval anastomosis, one of them we have already described, that is between superior and inferior epigastric veins, yes, it is cava-caval anastomosis. The other cava-caval anastomosis is located in the posterior abdominal wall. Okay, not here. No, it's not visible. But we know that lumbar veins are parietal tributaries of inferior vena cava, and also here, to the right and to the left from the vertebral column, 2 more veins are formed: right ascending lumbar vein and left ascending lumbar vein. And they pass through the diaphragm, and they continue to the thoracic cavity, and in the thoracic cavity they are named azygous and hemiazygous. Right ascending lumbar vein continues to azygous, Yes, this one is azygous vein, vena azygos. Right ascending lumbar vein continues to the azygos, and left ascending lumbar vein continues to hemiazygos. Hemiazygos vein drains at the level of the fifth thoracic vertebra. Maybe not fifth, you'll check it, to the azygos vein, and then azygos vein drains into superior vena cava. This is superior vena cava. Okay. And between lumbar veins and right and left ascending lumbar veins, there is also anastomosis. Okay, that's what you have to study for the next lesson. Any questions?
Okay.